Have you ever really thought about what it takes to trust a piece of equipment? I don't just mean that it turns on, but that it works perfectly every single time, especially when actual lives are on the line. Okay, let's get into it and take a look at how you validate something like a super freezer. So, take a look at this. It might just look like a very cold, frosty box, right? But what's inside? Wow, we're talking millions in temperature sensitive medicines, maybe critical vaccines, or even biological samples that add up to an entire lifetime of research. The stakes? They could not be higher. And that's the whole point, right there. A tiny, tiny fluctuation in temperature, just a couple of degrees off, and all of that value, all of that potential to save lives or make a huge discovery, it could all be gone. Just like that, completely worthless. So yeah, this is obviously about so much more than just keeping things cold. This first part is all about understanding those incredible stakes and really getting why things like certainty and safety are absolutely non-negotiable. And this isn't some niche problem. Across the entire life sciences industry, the safety and the effectiveness of the products we all count on, well, it all hinges on one critical thing: precise and, more importantly, proven temperature control. It's kind of like an invisible guarantee that the medicine you might take is safe and is actually going to work the way it's supposed to.
So, how do we get that proof? Well, it's not a suggestion, it's not a best practice, it is a straight-up mandate from regulatory bodies all over the globe. Let's take a look at what that really means.
See, this whole process isn't optional. It's mandated by huge global agencies like the World Health Organization and the FDA. It's a core piece of what's called GXP, or Good Manufacturing Practices. And the ultimate goal? It's simple, but it's tough: to create documented, verifiable proof that a piece of equipment is absolutely fit for the job it's meant to do. And what's really wild is the scale of this. The exact same rigorous principles apply whether you're validating a tiny freezer in a lab or a colossal warehouse-sized cold storage facility. The process, the rules, they're universal. Okay, so how is it actually done? Well, it all boils down to a very formal three-step process. It's all designed to build undeniable, documented trust in that piece of equipment.
The official name for this whole shebang is qualification, and the World Health Organization defines it as the action of proving that your equipment and all its systems work correctly and give you the results you expect. You see that word again and again: proving.
Now, this process unfolds in three distinct stages, and you have to do them in order. First up, you have installation qualification, or IQ. Then comes operational qualification, or OQ. And finally, the big one, performance qualification, or PQ. So let's actually unpack what each of those really means. To make this super easy, let's start with an analogy. That first step, IQ, just think of it as the blueprint check. It's the absolute foundation. And the IQ process itself is, well, it's actually pretty straightforward. It's all about verifying the basic facts on the ground. Does the model number on the freezer match what you ordered? Is it installed in the right place with the right power source? Do you have all the manuals and the calibration certificates? And did you check it for any damage when it was unpacked? It's that essential first step, just confirming you have the right tool and it's installed the right way. Okay, let's move on to the next two stages and their analogies. Operational qualification, or OQ. That's the empty stress test. Then you have performance qualification, PQ, which is the real-world gauntlet. Now, they sound kind of similar, but the difference between them is absolutely critical. So OQ happens when the freezer is completely empty. You're testing every single function, every button, every alarm to make sure it works exactly like the manufacturer said it would. But PQ is the true test. The freezer is now loaded with either the real product or something that simulates it, and you're verifying that it performs consistently under the stress of real-world conditions. People opening doors, daily use. Empty versus loaded. That is the key difference. Right, so how in the world do you gather all the data to prove performance during OQ and PQ? I mean, you can't just trust the little number on the front of the door. You literally have to map what's invisible. See, here's the thing. A freezer isn't one single uniform temperature inside. There are always these tiny variations, invisible hot spots and cold spots. That single temperature display on the outside, it doesn't tell you the whole story, not even close. To get the real picture, you have to do what's called a temperature map, using a whole grid of independent sensors. The whole process kicks off with this little guy, a high-precision, independently calibrated sensor. It's called a data logger, and it's designed to do just one thing, but do it perfectly: accurately record temperature over time. And of course, you don't use just one. You place multiple data loggers all throughout the freezer in this really strategic, pre-planned grid. You want to cover every possible spot: high, low, front, back, all the corners, and right in the center, to get a complete thermal profile of that entire space. So these loggers just sit there and record data continuously, usually for 24 hours, maybe more. And what you get is a graph that looks like this. Each one of those lines represents a different sensor. The goal, the dream, is to see all those lines stay packed super tightly together, all inside your required temperature range. That visual right there, that is your documented proof that the whole chamber is stable and uniform. But hold on, passing this test once isn't the end of the story. This is not a one-and-done kind of deal. It's really a living, breathing process of trust and verification. A successful qualification doesn't just give you a thumbs up for that moment. It sets up a whole system for the future. You establish things like continuous monitoring and alarms. You create a formal procedure for how to handle any changes, and you define exactly what would trigger a full requalification, like a big repair, a modification, or even just moving the freezer across the room. And this is the really intelligent part. It's not just about blindly ticking boxes on a schedule. It's a smart, risk-based approach. If a unit consistently passes its mapping with flying colors every single time, you might actually be able to extend the time between doing it all over again. The data from its own performance history guides the process. It makes it both really robust and efficient. And at the end of the day, it all comes back to this. Every check, every sensor, every single piece of paper, it's all in service of one ultimate goal: guaranteeing patient safety and ensuring the absolute integrity of the products that we all depend on. So in the end, this whole rigorous process of validation, it ensures that from the lab all the way to the pharmacy, a promise is being kept. It's one of these incredible, invisible systems of trust that's always working behind the scenes. And it really makes you wonder, right? What other invisible processes are out there protecting you every single day?